Hi everyone, welcome back to another video. In today's video, we are doing a glimpse of a medical coder's workday. So I'll be going over some of the CPT codes that I built out today. And I thought that this would be a lot easier than having to film my entire workday. So the books that you guys are going to be seeing me use are my Optum OBGYN Coding Companion, as well as the Optum ICD-10-CM Professional for Physicians. This is the 2025. I do prefer the ICD-10 for Physicians Expert by Decision Health, but my employer was only able to send me the Optum ICD-10 book, but this one is my favorite. So let's get into today's video. Oh, and we will be looking in my CPT book because some of the codes that I built were not in my coding companion. So you guys will see me use CPT in a little bit. But the very first thing that I reviewed or looked at was some blood draws. I don't always bill these blood draws, and it's the 36415. My office does blood draws for the blood to be sent over to the lab to determine if the patient is pregnant or not. Sometimes they need to check levels and things like that. So we do bill the 36415. We do not bill the lab code because the lab will bill for that. So we just bill for the procedure that we performed. So that is 36415. After that, I did review some urodynamic studies. So this is when they are trying to see how well or how strong your bladder muscles are. And they're trying to see how well you can hold your bladder once they fill it. So the complex cystometrogram is the 51726, but I am billing the 51729 because this will include the voiding pressures as well as the urethral pressures. And then I was trying to show you guys the complex uroflow. I think that's what it's called. I might be saying it wrong, but I was trying to find that, but they didn't have the code, so I'm going to have to pull it up in my CPT book. So I'm going to switch books really quick. Here we are in my CPT book. I'm just going to flip to the bladder procedures. I don't know why I stayed over here in the female general system for so long because the codes are not over here. If you think of the type of procedure you're doing, then you should know which section of your CPT book you should be in. So if we're working with the bladder, that would be urinary. So here we are. And I am going to be looking at the 51729, like I said. We also billed 51797 because they placed the catheter in through the vagina, so that will meet for the intraperitoneal. So that is that code. And then they also did the complex uroflow, so 51741. This is when the patient empties the bladder before they even do the cystometrogram. So that test is testing how fast the patient is being able to empty her bladder. And then up here at 51797, you guys will see that it says you can only bill this in conjunction with 51728 and 51729. So if you're not billing these two codes, you do not bill for 51797. So up here, 51726 and 51727 are or cannot be billed with 51797. It tells you the codes that you can bill it with. After that, I did have some deliveries that I reviewed. I'm sure you guys are familiar with this page, both pages actually. With me being an OBGYN coder, I'm most likely going to do some type of delivery every single day. So we have vaginal deliveries, cesarean deliveries, as well as delivery after previous cesarean delivery. So that's pretty much a VBAC. That's when the patient delivers vaginally after she already had a C-section with her previous pregnancy. And then we have the attempted VBAC codes, but then they ended up doing a C-section. So usually these are the trial of labors, and then if they aren't successful, they're not able to deliver vaginally, they go in with a C-section, then you bill the attempted vaginal delivery code. But today, I think I just had some normal vaginal deliveries as well as regular C-sections, nothing special. We have our 59510, which is the routine or global C-section, where you're billing for the patient's entire pregnancy, the delivery, and the postpartum care. I'm trying to think if I had any abortions. Actually, I had a treatment of incomplete abortion, which is 59812. What had happened was the patient had already received, what would it be called? Like, I don't know, I don't want to call it guidance, but she had already been assessed for a missed abortion. So they had prescribed her, I think it's called Mexotrox something. I don't know if it's Mexotroxate, but they had prescribed her medication to help pass the pregnancy. And she did not want to have to do a DNE or DNC. So when they had found out that she was still bleeding, I think after 2 weeks or so, they ended up having her schedule a DNE anyway. So they ended up doing the dilation and evacuation, which is the 59812 treatment of incomplete abortion. And I actually don't see the diagnosis code that I used here, which doesn't mean that I can't use it. It's just maybe not common for it to be in the coding companion, but I will show you guys the code that I build. And feel free to pause the video at any time if you guys want to read more information for yourself. But these here are the common ICD-10-CM diagnosis codes. And then I'm getting ready to show you the code that I used, or the ICD-10 code that I used for this case or operative note, whichever one you want to call it. So let me grab this book here, and then I will flip to the O codes. Okie dokie, so it's going to be a 007 code, and we're going to be looking at 007.1, delayed or excessive hemorrhage following a failed attempted termination of pregnancy. And I'm so sorry if I'm not going the long way, which would be like looking up the codes in the alphabetic index and then coming to the tabular list. I'm short on time, so I just want to be able to get you guys to the meat and potatoes. Okay, so moving on, the next thing I reviewed, I believe, was an NST, and the patient had came into the office. This was not a scheduled visit. She had thought that she was in labor, so she came in and they decided to do an NST. She was past 37 weeks, so we're going to be looking at 047.1 for our primary diagnosis code, because after the NST they determined she wasn't in labor and she was sent home. So our primary diagnosis code was 047.1, and I don't remember which week she was. I just know it was after 37 weeks. So here is a shot of all the weeks of gestation codes. They pretty much are aligned with how many weeks she is, except for if she were to pass 42 weeks, then you will be looking at the Z3A49. And then if the patient is before 8 weeks, you are looking at Z3A01, and then if it's ever not specified, Z3A00. So those are all the weeks of gestation codes. I usually will go back and forth and show you guys weeks of gestation in some of my videos, depending on the delivery I'm doing, but today we'll just have one shot of the weeks of gestation, and then that's it. So now I'm going to show you the NST. So that code is going to be 59025. And that code is, I think, a couple more pages back. Okay, right here. So this is the code that I built. And because my office owns the equipment, we are not going to append any modifiers. So down below here underneath the coding tips, they tell you about modifier 26 and TC. You would build 26 or use modifier 26 if you were billing for the professional, so the provider only, or you would build TC if you were billing for the technical component, which is the equipment that was used. Because we're billing for both, I'm not putting any modifier on there. And then here are some other common diagnosis codes that are billed with the NSTs. And then after that, I did start looking at a sterilization, which we did this, or the doctor did this laparoscopically. So I built 58661, and here is 58611, which is done either intra-abdominally, where they open the patient up completely during another surgery. Also, this is billed if it is during a C-section, but that's not what they did. They did laparoscopic, so the patient's not fully open. There's like 3 small incisions that are made, and it's going to be the 58661 for this, which we did receive guidance from ACOG that stated that this would be the more appropriate code to bill for elective sterilizations, because prior we were billing 58600, I believe. So here I'm just showing you all the diagnosis codes, and you see that Z30.2 is not a common code. It's actually over here underneath 58600 through 58605. And underneath the explanation, it says in the second sentence, the procedure may be done through the vagina or through small incision just above the pubic hairline. So this is a code that we were using. And if you are using this and you're an OB coder, I'm not going to say you're doing the wrong thing. They both kind of sound similar. We just decided to follow what ACOG recommended, and that was to build the 58661 and use the diagnosis C30.2. So who's right or wrong? Who's to say? And ACOG does tell us, like, you don't have to bill based off of what they're recommending. Always, follow your payer guidelines and things like that. So if you have payers that say, well, we don't bill that way, the 58661, and we have our, what would they be called? Not patients, but we have our, would they be referred to as a policy holder? I'm not sure, but the payer would let you know that they prefer you build a certain way, and then you can either follow the way they want you to bill, or you may have to adjust off or appeal. Who knows? It's welcome to billing, or coding, I should say. Alrighty, so after this, what did I look at? I know I had an IUD removal, which is pretty simple. 58301, removal of intrauterine device. And then the diagnosis code was Z30.432, encounter for removal of intrauterine contraceptive device. Sorry, I didn't know if you guys heard me or not. But after that, I think I then had what is it called? A TVT, which is a sling operation. Yes. So 57288, this is for a patient that may have stress incontinence. Actually, I think it might have been the same patient that we did the urodynamics testing on, and the patient had came back and was scheduled for this procedure. So usually if they do determine that the patient does have stress incontinence, then they probably will go with a TVT to help her be able to hold her bladder and things like that. So 57288 is our CPT code, and then N39.3 is our stress incontinence ICD-10 code. So yeah, that's pretty much it for today's video. I want to thank you all for watching. I hope you guys like this style. Let me know. It's a lot easier for me to go through the codes and talk to you guys and explain my thought process. So if you enjoyed it, please leave a comment down below, and I will see you all in my next one. Bye, guys.